So we have installed this machine in our hospital more than 3 years back, and we see a lot of patients who are inquisitive and want to know what they are made up of. They just stand onto the machine and get it done. And when we ask them to come here for a discussion, they just say, no, I don't have time. I just need to leave. I can't spend some time to understand the report. So they just want to get the information about the body, but not even trying to understand it. It took me literally 10 years of my knowledge on this thing, and after attending 2 complete days of a seminar on this particular machine to understand what it gives and how we can interpret it and how we can make use of it in our medical knowledge. So it is always important to discuss this and try to know what exactly is there that you're getting from this machine. So if you look at the body composition machine, the first parameters that you get is what are we made up of? What is the water quantity? What is your weight? What is your bone mass? What is your fat mass? And what is your muscle mass? So if you're weighing say 60 kgs, it tells you how many kgs of each of these are there in your body. So that's the first section of your body composition analysis. And the next one that you get is called as a fat muscle ratios. In this fat muscle ratios, you know how much of your body is made up of fat, how much of your body is made up of muscle, and what is your total body weight. So if your total body weight is more or less, or if it is staying in the middle, the same way what is your muscle mass, if it is more, less, or it is normal. The same way fat mass, if it is more, less, or in the middle. So if all the 3 are exactly as per our requirement, we get something called as an I curve. So if I just join the lines of these 3 things, it should represent an alphabet of I, which is ideal. So the same way, if I have more amount of fat and weight and less amount of muscle, the graph shows a C graph. A C-type graph says that we need improvement. At the same time, we can have more muscle with less fat and less weight, which is ideal. We get a D shape of graph. That is an ideal graph which you can expect out of this body analysis. The next thing that you can get is the segmental distribution. So for both the lean mass and the fat mass, we can get a segmental distribution. So how much of muscle is there in my right lower limb, how much of my muscle is there in the left lower limb, how much of it is in the right upper limb and left upper limb and the remaining center part of the body. So if we are having an equal distribution, or are we having less muscle in one particular region or area. So when we know this, we can try and improve the composition of the muscle in this particular regions. The same way, fat distribution, also we have these 5 regions. So what is very important about fat distribution is the central location of the fat. If we are having too much of fat stored in the center part of the body, there is a higher risk of it getting into our tissues like pancreas and liver and resulting in a thing called metabolic syndrome, which is responsible for diabetes, hypertension and all other hormonal imbalances. The next what we can get about this body analysis is how much of fat loss that we need to have, how much of muscle we need to build. So there are scenarios where someone might require to build their muscle and some will require to only lose their fat. So depending on this, we can set our targets of how much of muscle gain that we need to have in the next 6 months and how much of fat loss we need to have in the next 6 months. So this guides us in seeing if we are improving or not. And the next category that we can get in this body analysis report is the central obesity. So what is the waist to hip ratio? So if our waist to hip ratio is abnormal, that can be picked up by this machine. Even though that is a very simple test, we can just use a measuring tape and get these parameters. This machine is able to tell us. And the very, very important part of this machine is to know the visceral fat. Visceral fat is the fat that is already started to deposit within our organs. Let it be liver, pancreas, stomach or the muscles. So if we know what is the quantity of fat which is deposited in it, based on this we can know if we are already in a pre-diabetic state or an established diabetic state. So this will guide us, a simple test which can guide us a pre-diabetes and established diabetic state. Apart from this, it gives us the basal metabolic rate and what kind of an exercise will burn how many calories for us. So it gives us for different exercises customized for you. Say if I am going for jogging for 30 minutes, how many calories is my body going to burn? So when we have this idea, we know how to balance the calories that we're taking in and the calories that we're losing out. By balancing this, we can maintain the health of a body. So we've been using this machine for the last 3 years on all our lifestyle patients, and we get very good insights about what is happening within the body. To just quote one small example. So we have got one patient who was losing the weight rapidly. But what we have noticed was in the second visit when we did a body analysis, the person was losing more of muscle than the fat loss. So this is something which happens when we consume less amount of protein and do not do any resistance activities. So when we take less protein, no resistance activities and directly cut down the calorie intake, the muscle is going to melt down to give calories, which is not a good sign. So we just modified their diet, telling that they have to take the protein and added a little resistant exercises like a resistant band at home. And that next visit, we could notice that the muscle was improving and the fat was being lost. So not just losing weight is important. We need to know which composition of your body that you're losing and which composition of the body you're gaining. So this gives us a better insights about what is happening when there is weight loss with the diet. Thank you.